Sir, we are able to hear you well, sir.
Can you hear me now? Can you hear me?
Very well, sir. Very well, sir. Very well, sir.
Should I connect now?
Sir, we have 1 minute, sir. I think all of them are joining. We can go on air in 1 minute.
Can you see my screen now? No.
Sir, we are able to see you only, sir. Not.
Okay, I'll do that. No problem.
Rajiv, sir. Good evening, sir.
Sir, good evening, sir. Hi, sir.
Kanna, sir. Good evening, sir.
Sir, Sahai, sir, Kanna, sir, all of you. Thank you, sir. Seeing you for a little longer period of time now. 3-4 weeks. After long period.
आज तो फिर बढ़ गया ये वेदांता वापस। हाँ हमने देखा था।
Hear me,
we
no?
can start, sir. Maybe you can
हमने
start.
268 पे बेचा, कर ले लेंगे फिर। हाँ 272 क्लोज किया। हाँ फिर आएगा, नहीं बंद होगा। अरे नहीं। हाँ उसका सबका बढ़ जाता।
Can we call a start, sir? Kanna, sir, Rajiv, sir, Hitesh, sir. So, good evening, friends. We warmly welcome you all for the postgraduate clinics. From last week onwards, we are allotting 1 hour for the exam-oriented Viva discussions. Last week, we had a discussion by Professor Khanna, sir, where the instruments, surgical instruments, and the Viva part were discussed very effectively. And people who have missed it can see them available on the YouTube channel. Friends, we have the honor of having one other very eminent teacher where the students, both undergraduates and the postgraduates, look upon. Professor Rajgopal Shenoy, sir, earlier the head of the department, now professor of surgery. He is formerly served as an associate dean of the academics at the KMC Manipal. More than that, as we all know him as an eminent author of 4 major textbooks. One is the Manipal Manual of Surgery, very much respected, and we are into almost now 6th edition. And the most recent one is the Manipal Manual of Clinical Methods, which is running on the 1st edition. Sir has published book exclusively on surgical instruments, and then he has also published a book for surgery for the BDS students for the 3rd year general surgery curriculum. Friends, sir is very recently elected as the chairman-elect of the ASA of the Karnataka state chapter. Also, he serves as an election officer for the upcoming elections, as well as he serves in the National General Council of the Association of Surgeons of India. And he has been honored with multiple orations and multiple publications. We have the honor of having Professor Rajgopal Shenoy, sir, to take you along the passage of how to read the X-rays images. And I have, in fact, we have discussed, and sir will be covering you up in like an ASCII format. So it will be also telling how to read this particular X-ray, and it will also tell what are the relevant clinical points. So we have 1 full hour of time for sir to complete this. And we also have the second part, which is going to happen on the 8th, that is the coming Friday, which will be touching upon the CT, MRA, and advanced imaging part. So, ladies and gentlemen, on behalf of all the senior faculty here, on behalf of the students, we warmly welcome Professor Shenoy, sir, to start his talk. Thank you, sir. Please go ahead with your remarks.
Thank you, Dr. Kanakwel, for giving this introduction. I hope I am audible. Okay, thank you.
Perfect.
Yeah. So, you know that COVID platform gave us a lot of opportunities for, develop friendship all over India, and a new platform on which we are all, now moving is this national PG clinics. Thank you, Dr. Kanakwel, for putting so much efforts for the last, 2021, so almost 4 years now. So we also had some discussion on these things during COVID time also. I still remember Dr. Anantakrishna, senior professor.
Yes, sir. Yes, sir. You are right, sir.
Pondicherry, and myself also had done some discussion on this. So teaching X-rays, these are actually images, scans, are important part of the postgraduate examination. So which I think all of us know. Why this discussion? Because, basically this is a exam-oriented discussion. Whatever I am telling does not mean that that is the only gospel truth, in the sense these are the only questions which are asked. Never like this. The X-rays can be unlimited, unimaginable, anything possible. We are only talking about common X-rays. Adequate knowledge of theory part. Management is also important whenever you address a X-ray. It's so important that, sometimes in acute abdomen, where you say ultrasound is not very diagnostic, CT we can't do, you can't delay, just one simple X-ray probably can decide that, okay, I can go ahead with surgery. These are also part of some quiz programs. It may help you. And as I mentioned, this may also help in your objective structured examination. So whenever X-ray is asked, either you take it in a hand or, it's viewed there. Please look at the X-ray carefully. Identify first, the site. Especially we talk this for the X-ray abdomen, correct? So you have to see which is the side, left side, right side, upper side, lower part. And most importantly, make a first statement. Is it a plain X-ray or a contrast X-ray? So that's how you start. Never give a diagnosis straight away. Even if the things are obvious, I'll be showing you those. So always take your time. Look at the X-ray. Look at, is it a plain X-ray or is it a contrast X-ray? Look all the parts. When we talk about the X-rays, we generally now confine to, head and neck, abdominal region. So is it a soft tissue? Are you looking at them? Bones, lungs, parenchyma, trachea, cardiac border, abdomen, parts, right side, left side. So look at the spine, look at the every possible organ, and so that you will not miss the diagnosis. So with this in mind, we will slowly now move on to start with some of the simple X-rays. I have mentioned to you, don't be in a hurry to jump and give a diagnosis. There's an arrow there, and I also written it is a cervical rib. But I request you people to say what you are going to see here is the plain X-ray. There's the lower part of the neck is visible, and upper part of the chest is visible. Look at the clavicle shadows, look at the bone, look at the ribs, and look at the whatever cervical vertebrae you are seeing. And you can see now, additionally,